Some things you could do at home when you're experiencing low back pain, especially if you're an acute patient, happened yesterday, is using ice. Ice will help reduce the inflammation and the pain that we're experiencing. If this problem persists throughout the week, you get to a point where now we can introduce heat. So sometimes patients will alternate ice and heat to help alleviate the problem. Heat in this scenario will bring blood flow to the area of injury to help facilitate healing. Now, what you also may do in this situation is we could present or provide exercises. Exercises are really important once we're getting out of that pain to be able to perform. Exercises and stretches to help restore proper mechanics of the lower back, but also stretch and lengthen the tightened tissue that occurred with the problem. Aside from ice, heat, and exercises to be performed at home, we may also pay attention to, or what we must pay attention to, is our posture. Our posture when sitting, when standing, when doing our job. We have to be mindful of what our back is doing in these positions so we remove strain and stress so the body is able to continue to heal and not stay in a place of strain. Last but not least, best recommendation you could give a patient from a day-to-day perspective is tips and technique on sleeping position. So those tips and techniques would be sleep on your back. If you're able to sleep on your back with your legs elevated, that keeps the spine nice and neutral, takes pressure off the organs, and provides some relief in the lower segment of the back where we see most of our problems. Now, if you say, "Doc, I can't sleep on my back," then I'd advise you to sleep on your side. But by doing so, put a pillow between your legs, a pillow that fills this space so we keep our spine nice and neutral and we don't strain the muscles of the lower body, lower hip, and back.